Hello everyone, welcome to the second video of Science in Radiology. So in this video, we'll continue with the few other signs that we encounter in our radiology practice. So let's see the first case. So what we are seeing here in this radiograph. So this is PA view of chest radiograph where we are finding calcification along the margin of the heart. So what is this? So this is basically indicative of constrictive pericarditis, and this particular appearance is known as armored heart appearance, and it indicates calcification in the pericardium, which signifies calcified constrictive pericarditis. So basically, when there is chronic calcific pericarditis, it leads to calcification, and finally, it limits the ability of heart to contract, and it decreases the capacity of heart in diastole. And most common cause in developing countries is tuberculosis. However, it can occur secondary to viral infection, trauma, and radiation treatment. So this is armored heart appearance. Next, in this CT coronal view, what we are seeing, we can see this is left atrium, and the calcification is specifically affecting the wall of left atrium. So it is not involving the pericardium. It is involving only the wall of left atrium. So this is basically atrium or coconut left atrium. And this term is used when large part of the left atrial wall is calcified. It is rare occurrence, but it can occur secondary to rheumatic heart disease, which is again very common in developing countries. It can occur secondary to end-stage renal disease as well. This pelvic radiograph is showing which sign? This is pistal grip deformity. So you can see there is a convexity along the femoral head and neck junction. So this indicates CAM type of femoroacetabular impingement. So there are two types of femoroacetabular impingement, pincer type and CAM type. So in CAM type of femoroacetabular impingement, we see this specific abnormality, that is pistal grip deformity or pistal grip sign. What is happening in this radiograph? So we can see abnormal branching opacities in the right upper lobe here. So this indicates finger in glove sign. So finger in glove sign indicates presence of bronchocele, and bronchocele can occur because of obstruction, or it can be non-obstructive in nature. So if there is bronchial obstruction because of bronchial hematoma, lipoma, carcinoid or carcinoma, or maybe because of congenital bronchial atresia, it leads to abnormal accumulation of mucus within the bronchus and formation of bronchocele. Non-obstructive causes of bronchocele are also very important. So there are three main causes of non-obstructive bronchocele: asthma, allergic bronchopulmonary aspergillosis, and cystic fibrosis. So this is finger in glove sign of bronchocele. What is happening here in this lateral radiograph of dorsal spine? We can see there is depression in the end plates here, abnormal depression. Basically, this indicates, you can say, H-shaped vertebra or Lincoln log vertebra. There is central end plate depression, which is quite characteristic of sickle cell disease. It occurs due to microvascular end plate infarction. So in sickle cell disease, sickle cells are sickle-shaped RBCs. They accumulate anywhere, and they can cause, ischemia in the organs. So it can lead to microvascular end plate infarction in the vertebral bodies, which leads to central end plate depression. And this leads to characteristic H-shaped vertebra sign or Lincoln log vertebra. And so this is quite characteristic of sickle cell disease, but it can also occur in other conditions like storage disorders like Gaucher's disease. What is this appearance of the vertebra called as? This is fish vertebra or codfish vertebra, which is characteristic of osteoporosis. So there is smooth concavity along both end plates. So this is biconcave vertebra. So fishes generally have their vertebral shape like this. So this is fish vertebra or codfish vertebra, which is characteristic of osteoporosis. What is happening in this radiograph? So we can see this is trachea and there is narrowing of trachea here, right? And on this coronal view again, we are seeing compression, side by side compression and elongation along the sagittal diameter. So this is saber sheath trachea. So saber sheath trachea is basically diffuse coronal narrowing of the intrathoracic portion of trachea with widening of the sagittal diameter, and it is commonly seen in COPD patients. What is this sign called as? This is galaxy sign, and galaxy sign is basically multiple nodules are seen in the lung window in the chest CT, and multiple micronodules they aggregate at one place to form a patch of consolidation surrounded by multiple other micronodules. So this is galaxy sign, which can be seen in sarcoidosis or in tuberculosis. Which sign is this? This is positive contrast study of the large bowel loop. So this indicates apple core or napkin ring sign. So this is associated with constriction of the lumen of colon by a stenosing annular colorectal carcinoma. Napkin ring sign is also described in CT coronary angio, which indicates a vulnerable plaque. So in napkin ring sign of coronary artery, you will find peripheral area of hyperdensity and central area of hypodensity, which indicates high risk coronary artery atherosclerotic plaque on CT angio. Apple core deformity has also been described in femoral neck. Cause may be synovial chondromatosis, tenosynovial giant cell tumor, amyloidosis, and RA. So it is basically because of circumferential erosion of the femoral neck because of intra-articular mass, and it leads to apple core kind of deformity in the femoral neck. Now, when we are talking about apple, then we must talk about the apple peel intestinal atresia, which is a rare form of small bowel atresia in which duodenum and proximal jejunum they end in a blind pouch, and distal small bowel they wrap around the vascular supply in a spiral fashion, and it gives an appearance of a apple peel. What is happening in this radiograph? We can see scimitar syndrome. So this abnormal pulmonary vein is there, which drains into the systemic venous drainage. So scimitar syndrome or hypogenetic lung syndrome is characterized by hypoplastic lung and anomalous pulmonary vein. So this anomalous pulmonary vein, it drains into the systemic venous system. It is a type of partial anomalous pulmonary venous return or congenital pulmonary venulover syndrome. What is happening in this CT? You can find abnormal fat stranding in the mesentery. This misty mesentery sign, which indicates sclerosing mesenteritis or mesenteric panniculitis. What is happening in the CT urography? You can see this ureter is hook-shaped or J-shaped. So this is hook-shaped fish hook ureter or J-shaped or hockey stick ureter, which indicates significant benign prostatic hypertrophy, which causes compression of the distal ureter, and it turns like a fish hook. J-shaped ureter has also been described in retrocaval appearance of ureter. So this ureter takes an abnormal course behind the IVC. So in retrocaval ureter, you can find reverse J-shaped ureter. What is this radiograph showing? So this is AP radiograph of the right shoulder joint, where we are not finding any half moon overlap. So normally we find this half moon overlap between the glenoid and the head of humerus. When there is loss of half moon overlap sign, it indicates posterior shoulder dislocation on AP radiograph. So on true AP image, we must see a half moon overlap between humeral head and glenoid. If this overlap is not seen, we must suspect posterior shoulder dislocation. There is one more sign which is described in posterior shoulder dislocation, and that is light bulb sign. Light bulb sign has also been described in hepatic hemangioma, where there is large hyperintense mass which looks like a light bulb and on this T2 weighted MR. And it has also been described in pheochromocytoma. So this light bulb sign of pheochromocytoma in the adrenal mass. What is this sign? This is donut sign or target sign. So this is a target sign of intestinal interception, which is also known as bullseye sign or donut sign. And this is because of concentric, alternating echogenic and hypoechoic bands. This is pseudo-kidney sign of interception. This is another target sign or donut sign of peripheral nerve sheath tumor, which can be seen anywhere in the body. In this case, it is in paravertebral location. In this case of hypertrophic pyloric stenosis, you are seeing not only a target sign in the axial view, but also a cervix sign of pyloric stenosis. This is another target sign or donut sign in a case of hepatic tuberculosis. And this is a donut sign of meningioma in the optic nerve sheath. When mesentery is pulled along with the interception, this gives an appearance of crescent. So this is crescent in a donut sign. What is this sign? Pediatric patient, erect abdominal radiograph. So this is caterpillar sign. So caterpillar sign is because of hyperperistaltic gastric waves which comes to an abrupt end at the pylorus. So this indicates pyloric stenosis, and this is caterpillar sign of hypertrophic pyloric stenosis. This is string sign of hypertrophic pyloric stenosis. There are multiple other signs also which are described in congenital hypertrophic pyloric stenosis, like string sign, beak sign, shoulder sign, and mushroom sign, and caterpillar sign. So this is beak sign of hypertrophic pyloric stenosis. On ultrasound, we can also see antral nipple sign, which is because of redundant pyloric mucosa which protrudes into the gastric antrum. So this is an ultrasound sign. Next case, what is happening here? This is a positive contrast study of stomach, which is showing leather bottle appearance or leather bottle stomach, which is because of linitis plastica or signet ring cell carcinoma of stomach. So it greatly reduces the capacity of stomach and it appears like a leather bottle. What is happening in this hand radiograph? This is trident hand. So trident like a trishul. So this trident hand is described when there is separation between the index finger and the middle finger and the middle finger. So it is seen in various chondrodysplasia, including achondroplasia, and the hands are short and the fingers are stubby. So this is trident hand. What is this sign? This is again a trident sign, but in brain, in a case of osmotic demyelination syndrome. This trident is also known as omega sign. So when this osmotic demyelination syndrome, it becomes confluent, it gives an appearance of piglet sign. So this appears like a snout of pig. So osmotic demyelination syndrome can give an appearance of a trident or a piglet sign. What is this sign? There is abnormal vessel here. This is sagittal MRI of the same case. This is tau sign, which represents presence of a persistent primitive trigeminal artery on the sagittal plane, and it resembles the Greek letter tau, which is basically equivalent to letter T in the English alphabet. So this represents a persistent primitive trigeminal artery. What is happening in this radiograph of wrist? Frontal and lateral projection. So we can see there is something wrong happening over here. So there is impaction fracture of the distal radius, and this is giving a typical dinner fork deformity. So this is dinner fork deformity, which indicates Colles fracture. So Colles fracture involves distal radius, and there is dorsal angulation of the distal fragment, which gives a typical dinner fork deformity. Which sign we are seeing here? This is Viking helmet appearance, which refers to the morphology of lateral ventricles on coronal plane in cases of dysgenesis of corpus callosum. This appearance is also known as moose head appearance. Next case, what is happening here? This is IVP, and we are finding lobster claw sign, which is a typical urographic pattern of papillary excavation that is seen in renal papillary necrosis. There are multiple other appearances which are also described in papillary necrosis, which includes ball on tree sign, lobster claw sign, club-shaped calyx, and signet ring sign. So you must be familiar with all these appearances of papillary necrosis. Claw sign has also been described when there is a large mass which rises from a solid organ. So presence of claw sign indicates that the lesion is actually arising from that particular solid organ. So presence of claw sign indicates that the lesion is arising from the solid organ. Absence of claw sign indicates that the lesion is extrinsic and it is just compressing the solid organ. What is this sign? This is scallop sign, which is seen in RA patients, and it refers to the scalloping of distal ulna into the radius at the radioulnar joint. So, so it gives a scallop shape with sclerotic border. So this is scallop sign. What is happening here in barium solo? This is corkscrew appearance of diffuse esophageal spasm on barium solo. It is also known as rosary bead esophagus, and it is because of multiple tertiary, which are non-propulsive contractions, and they interrupt the normal peristalsis. So this gives an appearance of corkscrew esophagus, indicative of diffuse esophageal spasm. Corkscrew appearance has also been described in midgut volvulus, where the distal duodenum and proximal jejunum, they give a spiral appearance in midgut volvulus. This is another appearance on barium solo, that is known as nutcracker esophagus, and it is because of high amplitude normal peristalsis. Peristalsis are propulsive, but they are of high amplitude. So there is a difference between diffuse esophageal spasm and nutcracker esophagus. In diffuse esophageal spasm, you get diffuse uncoordinated contractions, whereas in nutcracker esophagus, the contractions are in coordinated manner, but the amplitude is excessive. What is happening in this CT image? We are seeing a COM sign, which indicates active Crohn's disease. So it is because of hypervascular appearance in the mesentery, and it indicates active Crohn's disease, or it can also be seen in other acute inflammatory conditions of bowel. and lupus mesenteric vasculitis. Which sign we are seeing here? Another barium swallow. This is a bird's beak or rat tail sign which indicates esophageal achalasia. And so the distal esophagus, it is narrow and it gives an appearance of a bird beak or rat tail. Another bird beak sign has also been described in the sigmoid colon in this positive contrast study of large bowel, which indicates sigmoid volvulus. This is tactile beaking, which refers to the fusion of midbrain colliculi into the single beak, which points posteriorly into the cerebellum, so indicates type 2 Chiari malformation. So this is tactile beaking. Beak sign has also been described in aortic dissection, where we find this beak on the false lumen side. So this is the beak sign which is present towards the false lumen. When we're talking about sigmoid volvulus, you must know about another sign that is seen in sigmoid volvulus, that is coffee bean sign. It is also known as kidney bean sign or bent inner tube sign. Next case, what is this sign? This is cobblestoning or cobblestone appearance, which indicates inflammatory process which is affecting the mucosa, more commonly in the Crohn's disease. So it can affect, hollow organs with mucosa. So there are multiple longitudinal and circumferential fissures and ulcers which separate islands of mucosa, and it gives an appearance of cobblestone. So there are islands of normal mucosa, and there are longitudinal and circumferential fissures which are filled with contrast. So this gives an appearance of cobblestoning. Cobblestone appearance has also been described in eosinophilic gastritis and candida esophagitis. What is this appearance? What is this sign? This is hourglass sign or collar sign. So it is a barium study of stomach, which is showing intrathoracic herniation of stomach through the defect in the left hemidiaphragm, and it indicates hourglass sign or collar sign. There are multiple other signs which are also seen with diaphragmatic rupture, which includes a cottage lobe sign, where we can see like this, a part of liver is protruding into the thorax, a part of liver is inside the abdomen. So this indicates cottage lobe sign. And when there is a rupture of the diaphragm, the hollow viscera or solid organs of the abdomen, they lie directly on the chest wall over here. So this is dependent viscera sign. So all these signs indicate diaphragmatic rupture. Next case, what is this sign? This is hummingbird sign or penguin sign, which indicates atrophy of the midbrain and reduction in the midbrain to pons ratio, and it is particularly seen in progressive supranuclear palsy. What is this sign? So this is axial T2 weighted sequence of the spine, and we are finding two hyperintense dots here. So this is owl eye sign or snake's eye sign, which is because of bilateral symmetrical circular or ovoid foci of high T2 signal in the anterior horn cells. So it indicates either anterior spinal artery ischemia or chronic compressive myelopathy. Snake's eye sign has also been described to show the normal appearance of facial nerve canal on a coronal temporal bone CT. In this lateral radiograph of wrist, are you seeing any abnormality or any particular sign? Well, this is pooping duck sign, which indicates triquetral fracture. So this is duck and this is its poop. So this is pooping duck sign, which is indicative of triquetral fracture on a lateral wrist radiograph. What is this sign or artifact, ultrasound artifact? This is twinkling artifact, which is seen with colored flow Doppler ultrasound. And it is because of presence of a highly reflective object like a calculus or air in the way of the ultrasound. And so this sign is very useful in identifying small stones, like at vesico-ureteric junction in this case. So this is twinkling artifact. What is this sign? This is swan neck deformity, and it is seen in RA patients. It is because of hyperextension of proximal interphalangeal joint and flexion of distal interphalangeal joint, and it indicates advanced rheumatoid arthritis. There is one more sign which is described in RA, that is bayonet deformity, in which reverse is happening. So there is flexion of PIP and extension of DIP joint. Uh, in thumb, we have Hitchhiker thumb deformity or Z thumb deformity, where again there is flexion of metacarpophalangeal joint and extension of the distal interphalangeal joint. There is one more deformity that is described in RA. It is Z deformity, which occurs because of radial deviation of the wrist and ulnar deviation at the finger joint. So metacarpophalangeal joint, there is ulnar deviation, and in the wrist there is radial deviation. So this gives the characteristic Z deformity. What is this sign? So this is Coca-Cola bottle sign. It is seen in thyroid ophthalmopathy or eye disease, where the ocular muscles are bulky, but it is particularly sparing the tendinous insertion. And so this is characteristic of thyroid eye disease, Coca-Cola bottle sign. And when we talk about the muscles that are affected in order of affection, so most commonly it affects the inferior rectus, then medial rectus, superior rectus, and then lateral rectus, and finally the oblique muscles. What is this sign? This is chain of lake sign, which is seen in chronic pancreatitis. It is because of dilatation of main pancreatic duct as well as side branches, which gives a characteristic chain of lake sign. So this is a MRCP sequence where we are finding this sign. What is this sign? So this is MRI knee coronal PDFS sequence where we are finding, instead of two cruciate ligament, we are finding four structures here. So this is quadruple cruciate sign, also known as Jack and Jill lesion. It is because of bucket under tear of both the menisci, both the lateral as well as medial menisci. So these fragments, they are displaced in the intercondylar groove, and it gives a quadruple cruciate sign or Jack and Jill sign. What is this sign? This is winking owl sign. It is because of destroyed pedicle. It can be because of metastasis, or it can be because of infection, or there can be congenital absence or hypoplasia of pedicle, or it can be because of neurofibromatosis. So this is winking owl sign. This is MRI breast in a case of breast implant, silicone implant. So what are these numbers indicating? So the one number is indicating teardrop sign. There is presence of silicone between the flaps. 2 and 3 are indicating keyhole or noose sign. So these walls are not touching each other. So this is keyhole or noose sign. So that this indicates intracapsular rupture of silicone implant. What is this appearance? These are just normal radial folds, and there is no silicone content between the folds. So this indicates normal silicone implant. What is this sign? This is linguine sign, and this is the most reliable sign of intracapsular rupture. So presence of intracapsular rupture is there, and multiple folds are floating inside the implant. This is also known as stapledon sign. So in this image, I will show you all signs that are seen in normal breast implant as well as in the intracapsular rupture. So presence of water droplets and inhomogeneous content do not indicate intracapsular rupture specifically. But presence of teardrop sign or keyhole or nose sign indicates intracapsular rupture, whereas linguine sign is highly indicative of intracapsular rupture. What is this sign? This is bunny waveform sign, which is basically biphasic morphology of vertebral artery Doppler, and it indicates subclavian steal phenomena. So in the when the subclavian steal is not obvious, it is partial or it is occult or it is in the process of occurring. So this is pre-steal state of the subclavian steal. And so there is abrupt drop in the systolic flow, and then again it is rising. So this is giving a characteristic bunny waveform sign of pre-steal in the subclavian steal syndrome. What is this sign? This is typical molar tooth malformation of the midbrain and hindbrain, and it indicates cerebellar vermal agenesis, and it occurs in Joubert anomaly. So this is molar tooth appearance. And there is one more sign which is seen in Joubert syndrome, that is bat wing appearance of fourth ventricle, although not very specific. What is this radiograph showing? This is cupola sign. So you can see presence of air under the central dome of diaphragm. So this indicates presence of pneumoperitoneum. When pneumoperitoneum is massive, it can appear like a massive football sign. So you can see presence of large amount of air in the abdomen, giving a football appearance. In pneumoperitoneum, we can also see leaping dolphin sign. So here you can see presence of air between the slips of diaphragm, and it indicates leaping dolphin sign. And this is indicative of pneumoperitoneum on a supine abdominal radiograph. What is this sign? This is beer paw sign, which is cross-sectional appearance of kidney, which is affected by xanthogranulomatous pyelonephritis. So there is presence of calcification in the renal pelvis, and the renal sinuses calyces are dilated and they are hypodense, giving a characteristic beer paw sign. What is this sign? This is beaver tail liver, which is because of elongated left lobe of liver, which covers the spleen. So we must identify this is a normal variation and it is not a pathology. It can be misinterpreted as perisplenic hemorrhage or subcapsular hematoma on CT and ultrasound. What is this sign? This is dromedary hump, which is another normal appearance of kidney. It is because of focal bulge on the lateral border of kidney. What is this sign? This is ears of the lynx sign, which is because of abnormal T2 or flare cone-shaped hyperintensity at the tip of frontal horn of lateral ventricle, and it indicates hereditary spastic paraplegia. What is this sign? This is eye of the tiger sign, which refers to symmetric bilateral abnormal low signal intensity on T2 weighted MR in the globus pallidus. And then there is central high signal intensity, which indicates Haller-Warden-Spart syndrome or PKN syndrome. So that's all for this video. We'll continue with the remaining signs in next video. Thank you.